So for today's lab, we're going to be looking at two systems together, mainly because these two are going to be working together in pretty much every aspect, the muscular system and the skeletal system. So let's take a dive in to see how these two systems help with one primary goal, movement. So when we use the term musculoskeletal, again, we're talking about two body systems functioning together, the skeletal system and the muscular system. We can't have movement without both systems being involved. The skeletal system provides a nice scaffolding, and the muscular system provides the contraction required for movement. When we look at muscles and how they anchor on the skeletal system, and when we say muscles in this case, we're going to primarily talk about skeletal muscles, which are voluntary. We see that these muscles are anchored across a joint. So if we look at these images here, we see the biceps right here. It's anchored across the elbow. Same thing with the triceps back here. It's anchored across the elbow. Before we get into the larger scale of bone, let's take a dive into the microscopic side and looking at histology of bone. Now here we see two images, both of which are bone, but they're different types of bone. Over here, where my pointer is at, we see compact bone. We'll talk a little bit more about compact bone later. And over on this side, we see spongy bone. Both of these images are bone, and both of these will be found in multiple types of bones, but they're going to have different roles in the bone as a whole. Now we're really not going to dive too deep into spongy bone at all. We just wanted to kind of introduce the idea of it. But we are going to take a close look at compact bone. So here's some terminology that we're going to look at first before we look at what compact bone looks like on a microscopic level. We see the term osteons. Osteons are the smallest unit of compact bone. I'll point these out when we look at the figure on the next slide. We also have osteocytes. These are going to be bone cells. And at this point, you may have noticed a trend. Osteo. Anytime you see the prefix osteo, it should ring a bell in your head to think of bone. Now, not every piece of compact bone is going to be a living tissue. It is a connective tissue, meaning we have a matrix. Our matrix is the non-living component, and it's going to be composed of these hard calcium salts. This is what's going to give us this rigidity and solid structure of bone. Since we're looking at a connective tissue again, the bone cells, the osteocytes, do need to live inside a little chamber or cavity. And we call that chamber or cavity a lacuna, or lacunae if you're talking about more than one. In the center of our osteon, we have the central canal. And we'll look at some of the inner components of that in just a second. And then linking all of our osteocytes together in their little chambers called lacunae, we have the canaliculi. These are going to serve as little tiny openings, little tiny pathways that link one osteocyte to the next. So here we have our image. Now, this image we see here is a larger component or larger section of compact bone, and there's multiple osteons that we see here. Here's one of our osteons kind of pulled up and out for us to see. So the osteon is this entire circular structure, and that's going to be our functional unit of compact bone. In the very center is where we find our central canal, and in that central canal we find some important things like blood vessels and lymphatic vessel. This way we have a direct connection to the bloodstream, even though we're a rigid, hard structure. If we look at this little insert, we take a closer look at our osteon, we see our osteocyte. And so you see that kind of pinkish color with its nucleus there in the middle. That's our osteocyte, and the chamber that our osteocyte is living in is the lacuna. Connecting that lacuna to other lacunae are the canaliculi. these little pathways that you see extending out from the sides, the top, and the bottom. Spongy bone can be seen off to the side over here. Again, their structure is going to be different. They don't have as organized of a pattern like compact bone has. If we look at the compact bone sections, everything is very ordered, very patterned. But when we look at the spongy bone, we see these trabeculae that kind of extend off into different directions, and there really isn't a distinguished pattern with the spongy bone. Let's move up a level and get to a macroscopic level. Now, bones can be classified based on their shapes. There's sesamoid bones, there's short bones, there's long bones, there's irregular bones, but we're not going to worry about all the different shapes. We're going to focus on just one, the long bone. And there's a lot of characteristics and features that we can see on the long bones. Now, when you hear long bone, the main idea is that these bones are longer than they are wide, and it's probably what you're thinking of when you think of a bone. Think of a cartoon bone from maybe Tom and Jerry or some other cartoon where a dog has a bone. That long, lean, skinny section in the middle and the two kind of rounded out ends. That's what we mean when we say long bone. Some of the key features we're going to look at on the next slide is the diaphysis, epiphysis, the compact bone, the spongy bone, the periosteum, and hyaline cartilage. So if we look at this image here, we see a typical long bone, right? We see the rounded out end on one side, it's rounded out on the other, and then a long skinny shaft in the middle. Very stereotypical of a long bone. But we want to get a little bit more familiar with some of the other key features and give those ones that we are already familiar with a more scientific name. So the rounded out portions that you see up here and down below are called the epiphyses, or epiphysis if you're talking about one. The shaft that we see in the middle, the long skinny portion, is the diaphysis. If we go a little bit closer and we look at the types of bone that we see in the epiphyses and the diaphyses, we see that spongy bone is the main component of the epiphyses, with a little bit of compact bone kind of acting as a shell in a way. And the diaphysis is going to primarily be compact bone. So when we ask something like, where would you find compact bone or where would you find spongy bone, you want to think about epiphysis or diaphysis. Now, surrounding our ends, the epiphyses, we also have some cartilage. Now, you may see it called articular cartilage because it's going to be in between where the bone articulates with another bone, meaning that bone is going to join with another bone. It's going to form a joint. Most of the time, that articular cartilage is going to be something like hyaline cartilage. We also have different types of bone marrow. Red marrow will be found in the epiphyses, typically, whereas yellow marrow, which is a place where we can store away fat, can be found in the diaphysis. In addition to having spongy bone and compact bone, we also have a covering surrounding the entire thing. Think of it, this was probably more accurate to say it's more like a shell, but it's a living tissue. We call that the periosteum, this living outer covering that's going to help protect our bone. We're going to move up one more level to the skeleton. So now we're actually going to look at the individual bones and what their names are. Before we get into the individual bones though, we can describe the skeleton with two divisions, axial and appendicular. Axial are the bones that fall along the midline, so bones making up the skull, the vertebral column, and the rib cage. Those will be part of the axial skeleton. Bones that help make up the limbs, things like bones of the shoulder and the arms, the hips and the legs, these will all be part of the appendicular skeleton. So we have two ways to describe or to divide the skeleton: axial and appendicular. If you're looking at the figure on the screen, everything in blue will be axial and everything in beige will be appendicular. Let's look at some of the examples that we find along the axial and appendicular skeletons. Like I already mentioned, with axial, the skull, the ribs, and the vertebral column will make up the axial skeleton. We'll talk about some of the individual bones making up those components. On the appendicular side, we have the pectoral girdle, also known as the shoulder. We have various bones in the arms, like the humerus, the radius, and the ulna. Various bones in the legs, like the femur, tibia, and fibula. And then the pelvic girdle, which is consisting of the coxal bones that make your hips. Let's take a closer look at the skull. The skull is not a single bone. Instead, it's a collection of many bones that have fused together with what we call sutures. Let's identify some of the bones of the skull. Now, for the sake of time, we will not go into all of them, but we will go into at least a handful. Let's start at the top of our list with the maxilla. The maxilla are going to be the bones that hold your upper teeth. So they're going to form kind of the bottom part of your nasal cavity and where your upper teeth will root into. The mandible serves opposite of the maxilla. Think of the mandible as your jaw. That's a more casual term we can use to describe the mandible. Your bottom row of teeth will be rooted in it, and this is the only movable bone in the skull, as this will help you chew your food and speak. The frontal bone is this large bone we see up here in yellow. It's forming what you would know as your forehead. The parietal bones are off to the side here in green. We can't see them very well from this angle, so we'll look at them again on the next slide. The temporal bone is another one that we can't quite see very well here, so we'll leave that one for the next one as well as the occipital bone, which is completely in the back. We cannot see the occipital bone from this angle. The zygomatic bone is this bone we see here in blue. It's forming the prominent part of your cheeks, as well as part of the orbit, where your eyeballs are held. The nasal bone is right here, forming part of the bridge of your nose. And the sphenoid, which we can only see in part, is right here in the back. We'll also see the sphenoid when we look at the lateral view on the side. So here's our lateral view, or our side view of the skull. Some of the bones we've already talked about we can see. We can see the frontal bone here. We can see the nasal bone. We can see the maxilla, the zygomatic, and the mandible. But some of the other ones that we could not quite see that well from the frontal view includes the sphenoid. Again, this one spans across the entire skull, so you'll see the same piece on the other side. The temporal. Here's the parietal in its entirety. And then in the very, very back, we have the occipital bone. You'll want to get familiar with these bones, as at some point in the future, you will be required to label or identify them. Let's continue down the axial skeleton as we go to the vertebral column. Now, the vertebral column is made up of several vertebrae, and we can break those vertebrae down into categories. The cervical region, the thoracic region, the lumbar region, and then the sacrum and the coccyx. The cervical, thoracic, and lumbar regions are all movable. They are not fused together. We have movement from one vertebra to another. But when we look at the sacrum and the coccyx, we have become fused, meaning there is no movement between those vertebrae. They're completely locked together. The cervical vertebrae make up the neck, of which you have 7 vertebrae. The thoracic vertebrae make up the chest, or the trunk of your body. And there are 12 vertebrae, or 12 pairs of ribs. It's a more accurate way to say that. Each pair of ribs will line up with 1 thoracic vertebra. So 12 thoracic vertebrae, 12 pairs of ribs, they match together perfectly. Down at your lower back, you have the lumbar region. There are 5 of them, and they're much larger than what we saw in the thoracic and the cervical regions. As we continue down, we get to the sacrum, which again, these are fused, and this is going to form part of your pelvis. And the very, very bottom, very tiny portion you see right down on the bottom, this little tiny triangle, is the coccyx, also known as your tailbone, where you have another 3 to 5 fused vertebrae. Let's go into muscle. Now there are 3 types of muscle, and we've seen these before when we went into histology. We'll talk about all 3 of them, but we're going to put our focus on one, skeletal muscle. If you remember, skeletal muscle had some key characteristics. The fibers were long and lean and cylindrical. They had multiple nuclei, and they had these striations, or stripes, that we see here. Skeletal muscle is also the only muscle that is voluntary, meaning you have conscious control over it. You can choose to flex or extend using skeletal muscle. You can choose to move your arms and legs. We don't have that opportunity when we look at smooth and cardiac muscle, and for good reason. Smooth muscle is found in things like your organs, for example, in your digestive tract. You wouldn't want to have to consciously think about contracting that muscle. Same thing with cardiac, which is found in the heart. You would not want to have to consciously think about contracting or relaxing your cardiac muscle. So smooth and cardiac are what we call involuntary. We do not have conscious control over the contraction or relaxation of these muscle fibers. To quickly review smooth muscle, in addition to its involuntary nature, we also have a single nucleus. We see them labeled here. There are no striations, and we now have a spindle-like shape. Cardiac muscle, we do see those striations, although in this image it's a little hard to tell. But our shape is also a bit different. Instead of the long, lean, cylindrical look, we have a branching appearance, and we also have intercalated discs that allow for rapid and quick communication from one muscle cell to another. Lastly, each muscle cell only has one nucleus. That sets it apart from skeletal muscle that has multiple nuclei in one single muscle cell. Again, our focus is going to be on skeletal muscle for the remainder of this, but we do want to remember smooth and cardiac. Let's take a closer look at those skeletal muscle fibers. I have some things here labeled with letters and their corresponding structure names and some information about them over here. Where we see A here, this portion we see in green is called the T-tubule. In B, what we see kind of wound around everything like a net is the sarcoplasmic reticulum. This is similar to the smooth endoplasmic reticulum we saw in a previous chapter. C is a myofibril. This is going to be the portion of muscle that contracts. It has one of the functional units of muscle called the sarcomere. We'll talk about the sarcomeres in just a moment. What we have labeled here in E is the sarcomere itself. And that zigzag line that we see going from one end to the other, labeled D, is the Z line. Covering this entire muscle fiber is the sarcolemma. This is just a special name for the plasma membrane we see on muscle cells. If you notice, there's another trend in the naming system. Sarco. We see this prefix many times. So if you see something with sarco, you should be thinking something to do with skeletal muscle. Let's take a closer dive down into the sarcomere itself. Here's a simplified image of what that sarcomere looks like. Now, we've already talked about what the sarcomere is and that it's the functional contracting unit of muscle, and we briefly described the Z-line. The Z-line will define those boundaries from where one sarcomere ends and another begins. But what's contained inside of our sarcomere? We have two main filaments that are going to allow us to contract. We have myosin, which is this thicker filament we see here in red, and actin, which is this thin line we see here in blue. Myosin can grab on and pull on actin. It's this motion that allows us to contract. Some other regions we want to be familiar with are the I band, the A band, and the H zone. The I band can be described as a location where you would only find actin. There's no overlap between actin and myosin in the I band. The H zone is similar, except we're looking at myosin. So the H zone is where you find myosin only, and you don't have any overlap with actin. The A band spans the entire length of the myosin filament, and does include where myosin and actin overlap. When myosin grabs onto actin and pulls, this is what's going to allow for the muscle to shorten and contract. Remember, muscles can only pull. They don't push. Think of it like a rope. Our sarcomere can pull like you would pull on a rope, but if you were to try to push on a rope, you wouldn't get very far. The same can be said with muscle and the sarcomere. Let's move up a level and look at individual muscles themselves. Now, before we get into the individual muscles, there's some key information that can hide in the name of the muscles themselves. We can find out information about the size of the muscle. For example, gluteus maximus. Maximus tells us it's the largest. We can get information on the muscle's shape. For example, deltoid. This is a triangle-shaped muscle in your shoulder, shaped like the Greek letter delta, which is also shaped like a triangle. We can name muscles based on the direction of fibers. Rectus abdominis. These are straight fibers that are running in one single parallel direction. We can also name muscles based on location. For example, the frontalis muscle is found over the frontal bone in the forehead. We can also name muscles on number of attachments. For example, biceps brachii. Biceps brachii actually tells us a couple things. Biceps, think bicycle, tells us two. The number of attachments is 2. Brachii tells us the region, brachium. That's going to be your upper arm. Lastly, we can also determine the action that the muscle performs based on the name. For example, extensor digitorum. This muscle will extend the digits, things like your fingers. Now, we will not get into every single muscle, but we do want to be familiar with some. I'll point out just a few of them, but do make sure that you take the time to look through the muscles on your list from your lab and to identify where they are on a figure or on a picture. Remember that some muscles are superficial, meaning they're close to the surface, whereas other muscles are deep. These are muscles that hide under other muscles, and the only way to view them is to remove the muscles that are moving over the top of them. Let's look at just a few of these muscles. We already mentioned deltoid. Deltoid, again, is a triangle-shaped muscle on the shoulder, as indicated by my pointer. The biceps and triceps brachii. Biceps, this is what, if you were to flex your arm like a muscle man, you would see on your arm. Triceps would be the backside of your arm. Latissimus dorsi. is also in the back, along with trapezius, forming part of your neck and middle of your back. Serratus anterior. The reason it's given that name is it looks serrated. Think of like a serrated knife from your kitchen. It's not a smooth blade, but a blade with a jagged edge. Rectus abdominis, also known as your abs. The external obliques, which are on your sides. The gluteus maximus, which forms the majority of your buttocks. The biceps femoris, which is part of your hamstring group, in the back of your thigh. The quadriceps femoris group, which is found on the front of your thigh. Sartorius, which runs from your hip down to the inner portion of your knee. And tibialis anterior, which attaches to your shin in the front of your lower leg. And lastly, gastrocnemius, which forms the bulk of your calf and attaches to your Achilles tendon. Again, this is a short list of the skeletal muscles that you need to know. Make sure that you refer to your lab manual for the long list of muscles that you need to be able to identify. Now, we talked about bones individually and we talked about muscles individually and how they contract, but we haven't put the two and two together to talk about movement and how we can describe those movements. Let's go into some terminology before we finish up to describe the movements we can conduct. We have flexion and extension. Stick your arm out in front of you. If it's straight, that your arm is extended. That's extension. But if you were to move your arm in at the elbow, creating a smaller angle at your elbow, this is flexion. So we are flexed at the elbow using the biceps brachii, and then when we extend the arm back out to a straight line, we've extended the angle at the elbow using our triceps brachii. There's also rotation. Rotation is when you move in a circular motion around one single point. So if you were to shake your head yes and no, if you were to rotate your head side to side in a no fashion, that would be rotation. Abduction and adduction refer to where you're moving the limb in terms of the midline or the middle of the body. Adduction, ADD, adduction, is when you move a limb in closer towards the midline. Abduction, ABD, abduction, is when you move the limb away from the midline. The little joke I like to give is that if you were abducted by aliens, the aliens would take you away. We also have circumduction. Circumduction is similar to rotation. However, instead of rotating around a single point, you're drawing a circle with that body part instead. Imagine that you're standing next to a whiteboard and you have a marker in your hand, and that I asked you to draw a circle without moving anything but your arm. If that were the case, you would stand away from the whiteboard, you'd make contact with the whiteboard with the pen, and then just moving your arm, you would move in a circular motion. That's circumduction. Lastly, we have a couple different ways we can talk about flexion of the foot. The foot's a slightly different area, in that both moving the foot up and down is called flexion. However, we have specific terminology to distinguish the two. Dorsal flexion is as if you were trying to move your toes up towards your shin, as if you were going to walk on your heels. Plantar flexion is the opposite. You're pushing your toes away, as if you were to go up on your toes like a ballerina. We can also roll onto the sides of our feet, both the inner and outer sides of our feet. We call this inversion and eversion. If you roll onto the outer blade of your foot, so that the soles of your feet are facing each other, we call that inversion. If you roll so that your soles of your feet face away to the outside, we call that eversion.